there is that black box, that secret ingredient that will take you from where you are, bringing all these things together to catapulting you into that leadership position.
To deliver improvements to ensure that it's patient-centered, family-centered, you have to leverage quality improvement methodologies to make a sustainable difference.
It's an innovative idea. It's an idea of its time.
The program is fantastic. I'm highly impressed.
This is world class, very standard. The resource person are the best in their field.
World-class lectures given by world-class lecturers from world-class institutions.
Across Africa, there is a need to develop stronger healthcare delivery systems in order to ensure that the countries are adequately prepared to combat the ongoing drivers of maternal and neonatal mortality. Prepared to handle outbreaks such as the recent Ebola epidemic, and prepared to deal with the ever-growing burden of non-communicable diseases.
Surveys conducted over the past few years have shown that there are some key drivers that determine poor health outcomes, that lead to poor health outcomes amongst Nigerians. And the key drivers include poor quality of care, as well as weak managerial capacities amongst healthcare providers.
It is critical that quality is imbibed to every aspect of the hospital, both the clinical and the non-clinical aspects of the hospital, because the non-clinical aspects of the hospital can impact the outcomes that you have in the clinical aspects of care.
The Healthcare Leadership Academy is guided by the governing philosophy that bold and innovative approaches are required to tackle fundamental health system issues.
The Healthcare Leadership Academy was primarily established to begin to address this gap that existed between the needs of the healthcare system as a whole and the skill sets that we have as healthcare professionals and as workers.
HLA is geared towards ensuring that health practitioners are appropriately equipped to deliver on their mandates.
The HLA is committed to equipping current and future generations of healthcare professionals with the skills, tools, and capabilities they require in order to address context-specific health system challenges.
Coming together to set up the Healthcare Leadership Academy is a culmination of several years of insights, research, and discourse about what the critical challenges are in the health sector in Nigeria.
The HLA's flagship program, the Healthcare Executives Leadership Program, was designed following an extended period of engagement with medical directors of clinics and hospitals.
This program is designed to assist participants better build their financial intelligence and business acumen to understand that every single decision they take, every single transaction they engage in has a financial implication.
This is a fascinating program in the sense that it is trying to introduce new management techniques to a set of healthcare professionals who may never have been exposed to these kind of modern management practices before.
Understanding that the needs of a healthcare executive span several areas, the HLA has adopted a balanced scorecard approach that would deliver world-class content and ensure capabilities are built across 4 critical areas. These areas are financial management, leadership and organizational development, quality improvement, and population health and health systems.
Financial management is essential to every organization. And when we talk about healthcare management, especially in Nigeria, there are a number of considerations. First of all, if we look at the providers of health services there, the greater majority is from the public sector, in which case they have to rely on funding from the government, in which case there has to be judicious use of these funds, also the application of the funds. But then in addition, there's a cost that is borne by the receiving public. Therefore, things such as the pricing model, the utilization, all of these are extremely beneficial. So when we talk about financial management, we're looking at trying to deepen the financial management skills of executives that play in this sector, be they in public health or in the private sector.
Delivering strong healthcare, delivering strong management, are leadership skills. the ability to have a clear vision for where you want to go, to work with people, to influence people, to help shape people's willingness to work together as a group, as an organization, as a team, to drive together towards a common mission that ultimately will have a huge impact and is having a huge impact on the lives of people throughout Nigeria and across Africa.
The discussion is focusing to combine the twin issues of quality and then access. And when one talks about quality, then quality improvement becomes even more important, because then we are talking about innovative solutions. These are local solutions that are harnessing the creative energies of frontline staff. And then, of course, when the leaders are involved in that conversation, it means that they can have a more structured, approach, and then they can create the kind of environment within which quality improvement can thrive.
I think that, if you were to just look at your individual patient sitting in front of you, then you only appreciate that patient and that condition in that particular time. The role of population health gives you a strategic overview of disease in a population, and therefore it allows you to have impact on a greater scale. It allows you to plan. It allows you to finance your healthcare provision to suit your population. So all of those understandings are really important. It allows you to collect data. It allows you to evaluate how well your health care provision is happening within your facility.
The course content is delivered over 10 weekends by global experts who have extensive experience in teaching executives and policymakers.
The practical approaches to the lectures are very excellent. It sticks.
This is down to the basics. I have to really give the Leadership Academy kudos for achieving that. Why? Most courses like this are within the context of the developed world. And here we have something that is developed for the Nigerian context. And I think that having the opportunity to participate in interactions about the Nigerian environment is exactly what healthcare practitioners in Nigeria need.
A key component of the program is the subsequent 8 months fellowship, which ensures that the capabilities built in each of the 4 areas are directly applied by the participants to their respective healthcare organizations in order to improve system performance and health outcomes.
The capstone project is a really, really good idea. Not because it's doing it and spending time on it is not going to be an extra toll on my energy and time, but you see, it's going to help us not to carry all this training and put it under the shelf. So it keeps us talking, keeps us thinking about it, and then it makes us use what we have been taught.
I do believe that the idea of a mentored program that follows you up, not only during the time of giving you the practical experience, so to speak, or the knowledge, so to speak, but to have people that follow you up as you are practicalizing any of this, that is where this program stands out above all the rest. And I'm looking forward to the next couple of months.
At the end of the program, graduates will possess the skills that they require in order to bring about transformative and sustainable system-wide changes to their respective organizations and local communities.
So I think we're on the path to creating an incredible cohort of leaders in the health sector. These are the people that will, it will not take up to 5 years, but in the next few years, we will see them begin to take responsibility for their populations, for the work they do, for the clinics, begin to offer a service that's so radically different from the way health services are provided now, and really start the transformation in our health sector that we all seek, and begin to be the change that we seek to build a better Nigeria.
With the way this first cohort is going, my prediction is that this is going to be the start of a revolution, that this is going to explode, that the coverage is going to increase, both in Lagos and in other parts of the country, that we are, with this, at this time, beginning to, make the right crop, generate and build an army of health managers, health leaders, health hospital management leaders that are equipped with the right tools to transform the healthcare system.
We believe not only is it going to transform our leaders across the African healthcare system, but it's going to be a learning lab for other people across the globe. Right now, there are so many folks that are actually looking and trying to understand the results of the Healthcare Leadership Academy. Folks want to know what's going to happen with it. And I believe that this is going to be a center of excellence, a global learning lab for the world, and not just for Africa.
I see HLA really closing the gaps in the healthcare system and ensuring that from national to state to local government to community level, whatever gaps are identified are closed, and we begin to see the evidence of this in the impact on populations, the impact on our indices in maternal health, in child health, in newborn health, impact on the health of men and women, on the health of adolescents. So there's so much that we can be doing and that we should be doing, and this is just the beginning.